Welcome to the Women at Sankalp session at the Sankalp Africa Summit 2021. My name is Mercy Mangeni from Intellecap, which is an Aavishkaar Group company. Since 2001, Aavishkaar Group has been steering and spearheading the impact investing space in India and globally to transform the lives and livelihoods of people in underserved markets. With a vision to bridge the opportunity gap for the emerging 3 billion, today, the group has impacted over 100 million underserved customers from across India, Asia, Southeast Asia, and Africa, and is managing assets of around $1.1 billion. We are delighted to announce the virtual launch of the Aavishkaar Group Impact Report 2020. The report showcases our impact learning through the eyes of powerful women leaders on International Women's Day on 8th March 2021. We would like to dedicate our group impact report to all the women leaders such as you present here with us and to the 60 million of whom have been part of the Aavishkaar Group's impact journey. We believe that it's imperative to include women in as many aspects of an economy's growth story as possible to create an equitable and thriving society. The report celebrates gender equality with 12 powerful stories of bold, resilient women who embraced risks to impact their communities in Asia and in Africa. It therefore gives me immense pleasure to introduce to you one such story shared by Muzalema Mwanza from Zambia, who's been on the forefront of advocating for safe motherhood and whose journey with us led to the creation of Safe Motherhood Alliance in 2017. Let us hear about her brave journey in her own words. Now, let's welcome Muzalema, whose story illuminates our humble purpose to change lives and impact livelihoods every day. Muzalema, it was inspiring to read your story in the Aavishkaar Group Impact Report 2020. In the report, I read that the challenges you noticed in the healthcare sector. It would be great if you could share this story with the audience and what motivated you to start your organization, Safe Motherhood Alliance.
Thank you, Mercy, for having me. It's a pleasure to be here.
So Muzalema, what were some of your challenges and what motivated you to start your organization, Safe Motherhood Alliance?
So I'm born and raised in Zambia. I am a qualified civil engineer and I did both my tertiary and professional education here and went overseas to the US and China for further studies. And then I came back to Zambia to settle and got married. So it was when I was pregnant with my first son that I had a hard time accessing quality healthcare, despite being a white-collar professional living in an urban area. For every month, during my antenatal care visits, I was asked by the hospital to bring my own birth materials, which included a list that stated I had to bring my own sterile gloves, surgical blades, disinfectant, umbilical cord, and so on, because of the broken healthcare system here in Zambia. And I was told that if I didn't have these things when I delivered, I would be sent back, or I would be asked to wait until either my family or my partner could bring these items to me. So after I delivered, really, I was frightened at the thought of having to repeat the whole process because I had to go from shop to shop, chemist to chemist, just to look for these items. And when I dug in to find out why the system was so broken, I found out that actually 64% of all women in Zambia, lacked adequate health care, just the same way that I did. And they ended up giving birth from either home or outside of a health facility. And this is what led me to start Safe Motherhood Alliance in 2017.
Right. So once you started, what were some of the challenges that you faced in running, the enterprise Safe Motherhood Alliance?
So at Safe Motherhood Alliance, what we realized was the major challenges were lack of access to sterile supplies, lack of access to medical personnel, trained medical personnel, and distances to the nearest health facility. So what we decided to do was to develop a low-cost, single-use baby delivery kit that contains all the items that is needed for a safe birth as recommended by WHO for a safe delivery. And new to the world of business, we needed funds to realize this vision. And this is where, I met Telecap and they helped me with some of the issues that we had in terms of marketing, and coming up with a viable financial plan.
Right. So apart from marketing, what other kind of support did you receive from Intellecap?
They helped us, come up with a, development scalable model, and also, a financial plan. They also introduced me to investor networks, which has really been key in helping us, launch our business and really make sure that we're serving the communities that we are in Zambia here.
Nice. Really great to hear. So what has been the impact of Safe Motherhood Alliance to women, at least in Zambia and the rest of sub-Saharan Africa?
Today, my organization, with support from, Intellecap, has been able to get funding and speak to organizations like UNICEF and other international funders. And to date, we've been able to distribute over 10,000 baby delivery kits to expecting mothers in Zambia and in the region. And we also recognize the role that TBAs, which is traditional birth attendants, play. And we also look at how can we also be culturally sensitive and ensure that we are able to work with them. So we have trained over 50 traditional birth attendants to be able to use our kits, ensuring that both mother and child are safe during childbirth.
Right. So what would be your message to other women entrepreneurs like yourself looking to raise capital?
I would say really take courage, be brave, and go after your passion. Go after what you're passionate about, especially if it's something that's really looking to uplift the lives of the community around you. I was running a successful business as a civil engineer before I launched Safe Motherhood Alliance. But because I saw the need in the community, I saw what mothers, pregnant women, were struggling to do when they were pregnant, just to give birth to a healthy child, something that should not be the norm. And that's how I decided to launch my business. And the success of it has shown that connecting with other organizations like Intellecap enables you to raise money, raise capital from funders. So, my advice would be go after your passion, but really try to connect with organizations who can help you prepare the right business model and financial model to be able to scale your business.
Right. And so what would then be your message to investors that provide capital when it comes to funding women-led businesses?
Well, statistics show us that women-led businesses are the least funded by investors. But I would really like to encourage investors to fund women, because when you fund a woman, really, you are helping a whole village. Women, we've been shown to be able to raise capital just as good as men. And also because, of who we are in society, we raise families, we look after homes. We also know how to be able to, scale up our businesses as well. So not only from our, village setup, community setup, like I had started in 2017, but now looking at the whole country. Currently, we are working in over 10 health facilities in Zambia, and the Ministry of Health has signed an MOU with us to be able to go into 2,000 of their health facilities in Zambia. So really looking at how do we connect that with the capital in order to be able to, reach more women. We're looking in the next 2 years to be able to reach 100,000 pregnant mothers with our baby delivery kits and our model, and train over 1,000 TBAs. This will be able to reduce the high mortality rates in the country and the region.
Thank you so much for such an inspiring story, Muzalema. It's really admirable to see how passion to nature has helped you overcome odds to be a flag bearer of life-saving natal care. This is only one of the stories that has been captured for prosperity in the Aavishkaar Group Impact Report 2020, which we're launching on the International Women's Day. Do download the report that shows how powerful human stories meet our impact intervention. To quote our founder, we hope to continue our work in the next decade to transform the Aavishkaar Group into an impact unicorn, changing 1 billion lives across the global south.
Provide sterilized baby delivery kits to pregnant women in rural areas and low-income communities. I developed the kit when I was pregnant myself on birth materials, gloves, scalpel blade, delivery mat, cotton wool, disinfectant. And I felt if I'm struggling, what are other women who are in worse situations going through? Which is what led me to come up with the delivery kit and pack everything in one kit as recommended by WHO.